Hello, I am Dr. William Audeh, Chief Medical Officer for Agendia, and I'm delighted to be able to discuss with you the Agendia gene expression profiling for early stage breast cancer, our newest data and clinical utility. MammaPrint, as you know, predicts the risk of distant metastasis and will identify a tumor as being at either high risk or low risk of metastasis. But in addition, we further stratify MammaPrint into ultra low and low risk, and within the high risk end, high 1 and high 2. On each sample, whether it's a core biopsy or resection specimen, we can also perform BluePrint, which looks at the subtype based upon gene expression profiling, identifying what's driving the growth of the tumor. And we identify luminal type, HER2 type, and basal type. Together with MammaPrint and BluePrint, we identify 5 distinct genomically defined subtypes, each with different clinical implications for prognosis and therapy selection. We have, of course, generated a great deal of data on the utility of low-risk MammaPrint and what we can learn from such a result, but our focus has shifted more recently to high-risk MammaPrint results. In fact, we now provide significant insights for both MammaPrint low and high risk. For MammaPrint low risk, of course, we answer the chemotherapy yes or no question, but we also provide support for endocrine management, identifying women who are ultra-low risk and may not require a full 5 years of therapy, as well as those who may benefit from extended endocrine therapy. In the high-risk realm, we now can predict with great precision the likelihood of PCR based upon MammaPrint Risk and BluePrint subtype. We also are studying the value of MammaPrint High 2 in the SWOG phase 3 trial, applying immunotherapy to hormone-positive breast cancers, with High 2 predicting benefit of immunotherapy in the I-SPY trial. And then most recently, as presented at ASCO, identifying those women who may benefit from the addition of anthracycline to the chemotherapy regimen in hormone-positive breast cancer. This most comprehensive analysis has led to significant neoadjuvant data, here showing the PCR rates for MammaPrint High 1 versus High 2 in hormone-positive breast cancer cases. And when we add BluePrint, we further stratify the PCR rates with greater precision, showing luminal B High 1, 5.8%, High 2, nearly 22%, and High 2 basal, 37%. A further aspect of this PCR data has been looking at the actual regimen that's used. And in this case, in data presented at Miami Breast Cancer Conference, we showed that MammaPrint High 1 patients do not appear to increase their PCR rate with the addition of anthracycline, whereas for High 2 patients, this seems to be necessary to achieve a PCR. And when we further stratify by BluePrint, we show that luminal B and basal breast cancers both have an increased rate of PCR with anthracycline. We've also most recently generated adjuvant data that were presented at the ASCO meetings this year and presented by Joyce O'Shaughnessy. We continue to generate a great deal of data on a variety of topics shown here, and I'm delighted to preview the fact that we have 2 abstracts selected for spotlight poster discussion at this upcoming San Antonio, and we hope to see you there.